second day after the treatment of my chemo, and looking back, it seems like yesterday was really hectic. I realized that they had 135 chemo day patients and one doctor on staff and one IV nurse, and the nurses were run off their feet. And that could have been the reason, actually, that they did notice that I had the allergic reaction initially, because my nurse had to go check on somebody else. And it's usually within the first few minutes that there is a reaction to the Taxotere. So I think that I'm wondering, I mean, if that hospital has raised so much money, I really don't see it going to patient care. And I'm even more concerned that they don't have an emergency area for the patients. They have to either go to Mount Sinai or Toronto Hospital. And I've heard the nurses state that, you know, there should be an emergency care in the hospital. And that is vital. And when you think of that it is a primary cancer hospital, that they should have priority and that they should be seen. They would be way down the list in a triage system at the other hospitals. They wouldn't be given priority unless it was urgent. Now, when I was on the ward yesterday getting my chemo, I noticed that there were 2 ambulance services called up because there were complications and they had to be taken to hospital. If they had an emergency, they could be taken right downstairs and be seen. That is of concern, and I think that people should recognize that that more priority should be given to patient care rather than research, especially when you have those type of high numbers, and we're not just getting the service that's actually being deserved by the citizens of this province or country for universal health care.